Hello everyone. Hello everyone who's tuning in here. I'm going to flip this camera around here. So let's see, I think you can see me now. And we're just starting our broadcast here today. I want to say, well, hello Steph Kreutz. Hi, thanks for coming in. This is a great talk that we're going to give today. I want to really welcome, hi Renee. I want to give a welcome to all our live viewers and especially to our replay viewers who are going to be coming back to watch this. I'm trying something a little bit different here today. I'm going to show you myself and then also the screen at the same time because the last scope I gave, people were saying they wanted to see a little bit more of me. So we're going to try something I'll show you here in a minute. But if you're new to me, if you've never been on my scope, please give me a shout out. Let me know where you're coming from. So wherever you're coming in from, if you can give me some ideas of where you're coming from here today, that would be great. I really want to know who's tuning in. Where in the world are you guys? Let me know. And for people who are brand new and have never been on my scopes before, hi Kim. People who've never been on my scopes before, type in the word beautiful and your name so I know that you're new to us, and we're very excited here. So some personal information about me. What I want to say, actually I'm sorry, before this I want to tell you, today we're going to talk about some really interesting things. Oh, from Vancouver, hi, how are you Renee? That's great, yes, tell me where you guys are coming from, that's great. So I'm going to give some really good information here that's going to help you for a long time in terms of your skin and your facial appearance. We're going to learn a lot here today. So if you find this interesting, please share this with people. I think this is a good value for a lot of people. Okay, so personally, my name is Dr. Adam Scheiner. I'm a specialist in eyelid and facial plastic surgery. I'm the author of a book called The True Definition of Beauty. I'm really fortunate. I have an international practice in what I do, and the reason I do is because I'm known for certain techniques that people come from all over the world to see me for my facial rejuvenation. I've been featured on Dr. Oz. Hey Shelley Singh. Hi, and I said before, if you're new to me, please type in the word beautiful and tell me where you're coming from. Oh, as an audiologist, that's great. So I've been featured on Dr. Oz, The Doctors, Howard Stern, the New York Post, the Boston Herald. I've been very fortunate this way. And I have this international practice. I do have an offer here at the end of this talk where you can get a free book. Oh, beautiful in Seattle, beautiful, great, Tracy from Houston, yeah, beautiful from Texas, beautiful from Jackson, Mississippi, that's great, Southern California, look at all these beautiful people. Well, give me some hearts here if you loved all the beautiful people who are joining us here. Oh, and a nurse, beautiful from Maryland, beautiful from Houston, that's great. Okay, so I'm going to turn this around. Let's see how this works, guys. You ready? Okay, so now give me some hearts. Can you see me in the camera there? I'm trying something new here. I'm going to split the screen so you can see me and my slides at the same time. What do you guys think? Give me some hearts if you like the way this looks. Beautiful from Orange County, great to hear people from California. I was just out there giving a talk. So today what I want to talk about is the #1 way, beautiful in Georgia. Welcome guys, welcome. Very good. So yeah, do you like the split screen? You can see me. Hi, you can see me here. Yep, I'm trying. It's beautiful from Tampa. Oh, we're here in Tampa. I'm in Tampa. That's great, Debbie Bryan. Excellent. Oh, I love the hearts. That's great. So I'm going to talk about the #1 way to prevent your skin from aging and what you need to know now. Okay, so let's start this. Let's see how I can do this. Okay, so this is me. And I know it's a funny picture here. There's a little laser pointer here. This is how many people like this picture of the baby with the old forehead? If you like that, give me some hearts there. And you can do the double tap of the hearts if you want. The double taps, right? So our skin, I talk about 3 Ds of aging: deterioration of the skin, deflation of the face, and descent of the eyelids and face. That's how we tend to age. And our skin, we don't often think about this, but our skin is our largest organ. We say that, okay, our liver is an organ, our heart is an organ, but really our skin is our largest organ. Its job is really protection. It protects us from infection. It keeps our body temperature. It's our fluid barrier. It's the biggest, sensory input, and it helps us make vitamin D in the sunshine. There's some layers of the skin I want to talk about here, and guys, pay attention. This is going to be useful. So there's the top layer called the epidermis. Can you see my laser pointer here? Epidermis, and there's a bottom layer there called the basal cell layer of the epidermis. This cell makes the cells above it. If this cell is healthy, all the cells above it are healthy. If this cell is unhealthy, all the cells above it are unhealthy. Down below this is collagen and elastic fibers, and this is where we get our collagen. This is where we get our resiliency of the skin. So let's remember this graphic. I'm going to show you this as we go along here. So how does our skin age? What do you guys think? the passage of time, right? Passage of time is part of it, but that's not the biggest thing. I'm going to show you some pictures of this in a little bit. That's not the biggest thing. The biggest thing is really sun exposure. Sun exposure is the biggest thing, and I'm going to show that to you. Yeah, give me the love there. So if you think that sun really affects you, you're right. Okay, so intrinsic aging, this is normal aging, this has to do with genetics. Then there's premature aging. This has to do everything with why we age, but we don't really have to age. This is photoaging, right? Sun exposure. And pregnancy, hormonal changes, topic products, they play a role too, but photoaging, that's the biggest thing. Sun protection, right? This is the best way to prevent skin aging. 90% of everything you know in terms of wrinkles, age spots, skin discoloration is due to sun or tanning bed exposure. Does it look like I'm looking at you right now, hopefully? Give me some hearts if it looks like I'm looking at you. I'm seeing if I'm looking at the camera correctly. A couple hearts there. Does it look like I'm looking at you? I'm trying to focus on the camera here. Okay, good, good. So, you know, sun and tanning bed exposure, that's how we age, okay? If we can protect ourselves, that's the best thing. Okay, remember I showed you that slide before about the epidermis and the dermis. Let me teach you a little about ultraviolet rays. When the sun comes down and shines on us, right, it shows us, there's visible light, allows us to see each other, right? And then there's also invisible rays. These are the ultraviolet rays. Now, there are three types I want to talk about. The first one is UVA rays. This is one that's a long wavelength. It is present from sun up to sundown. It will penetrate clouds and car windows. You think you're in the car, you're safe. Not necessarily. This UVA ray can penetrate clouds and car windows. We'll talk about that. It penetrates through the epidermis, goes into the dermis here, if you look at the slide, and actually fractures the collagen and elastic fibers and allows our face and our skin to droop and sag. And who wants drooping or sagging skin? None of us, right? Okay, give me some hearts if you don't want drooping and sagging skin. Let me hear it. Okay, there we go. All right, none of us want drooping or sagging. Right. I love the hearts. That's great. UVB, okay? UVB gives sunburn. So A is for aging, B is for burning, and it's most prevalent from about 10 to 2. UVC is toxic to life, and that's great. I'm seeing someone there, they still use sunscreen all year round. That is exactly right. Veronet counseling, that's great. Okay. So SPF, we've seen SPF, right? It stands for sun protection factors, regulated by the FDA. It only applies for protection from UVB rays. It really, just recently the USA has started to have some measure to help us understand about UVA rays, and that's called broad spectrum and water resistant. That's what you're looking for, broad spectrum and water resistant. That's what's going to help protect you. You need sun protection that protects you from both UVA and UVB rays. Now here's the thing I want to talk about. This is critical because this is a little bit under the radar, right? But incidental exposure matters. Every time that you're outside exposed to the sun, the radiation from the sun is causing some skin damage. Or think about, okay, when you go from your home to the mailbox, right? Not a big deal. Well, honestly, there's a little bit of UVA rays during that time. How many of you find that interesting? Give me some hearts if you find that interesting. The idea of UVA rays and just going to the mailbox, getting sun exposure. We say, no, that's not a big deal. How about when it's raining or when it's cloudy? Well, I'm going to tell you, this does occur. It is critical, guys, it's critical to wear sun protection every day on all exposed parts of your skin. That means back of the hands, the neck, the face, the ears, right? For you, for your family. How many people have children? Give me some hearts if you have children that you want to protect from the sun. Give me hearts if you have children you're protecting. Let me hear it. Let me see it. Great, right. So you want to protect your kids also. The sun protection, saying, what sun protection do I recommend? Mechanical blocks, things that have titanium oxide or zinc oxide. They do this a lot for infants. Those mechanical blocks work immediately when they're on the skin. So that's what I give for my family too, and that's what I use. Okay, so it's critical every day, right? Every day. So I'm going to do this a little bit as a slide because I think it works better this way. Hold on. Okay, so I'm sorry that I disappeared here for a minute. Okay, so this is a picture. Now, how old does this person look? Give me some comments. How old does she look? Some comments, guys. How old does she look, do you think? About? Anybody? 100, yes, 100. 120, yes, 120. 98, exactly. Okay, who wants to know the truth? If you want to know the truth, give me some hearts here. Who wants to know the truth? There we go, okay. There we go, okay. She's 58. Are you surprised by that? She's 58. She's an American Indian, and she worked as a migrant worker during her entire life. She looks much older than, I agree, she looks like she's 100, right? But she's 68. Now this guy here, how old does he look, do you think? In your comments, let me see. How old is this guy on this side? How old does he look? Give me some ideas. Just put it in the comments. How old does he look, guys? 75? Yeah, well, okay. Yeah, 10, yeah. I'd say he looks, he's 78. 55, he's 78. But look at the difference. He was meditating indoors most of his life. Look how good his skin is compared to hers. Do you guys see the difference there? You see the difference? Okay, I'll go back to our... Okay, I'm back. How many people are happy to have me back and see me again? Give me some hearts for that. Okay, so I just wanted to show that to show you this. So this was a picture of a woman. Now you see this picture on the side with all the wrinkles. Can you see that? And this side. So she worked in a corporate environment, and she was lucky in that she rose to the ranks of her business, and one time she was able to get a corner office. And the sun would come in and warm her cheek every day. Can you guess which side of her face was facing the sun? Right, this side, right? And at the very end, I can answer questions about split screens. We'll talk about that. So she has this side of her face was facing the sun. Now, which UV? I mean, it's written here, but UVA, right? I was talking about that. I said you're in the car, you feel the sun, you're like, I'm fine. No. I mean, you actually do get sun exposure. That's UVA damage over time. How many people find that interesting? This is someone who worked for years in an office and one side of her cheek faced the window, right? Do you see that? That's why it's so important, guys, for you, for your family, your loved ones, your kids. You've got to protect yourself, okay? This was a truck driver who worked in Australia, and one side of his face was facing the sun, one side wasn't. Can you see the difference here, guys? This is UVA rays over time. Look at the difference here between the two sides of the face. How many people are impressed with that? Give me some hearts if you're impressed with this damage between these two sides. Ooh, I saw a picture go by, a picture frame. That's cool. Excellent. And some hearts. Let me show you this. Now, if I did this myself, but if we split his skin, this would be like if he never had any sun exposure, or if he did have sun exposure. You see the big difference? I'm telling you, protecting yourself in the sun is so important. Now let's talk a little bit about some medical things, guys. UVA radiation, right? UV rays come in, they break the collagen elastic fibers in the skin, and they break the DNA, they bind the DNA into something called thymine dimers. Thymine dimers. These form irregular DNA, they replicate themselves poorly, and that results in skin cancers, mainly the basal cells and squamous cells. Not seen in melanomas this way. Let's keep talking. Melanoma is deadly. We'll talk about that. Basal cells, they don't really metastasize, but they're locally destructive. Actinic keratoses, these flaky skin lesions, about 1% will change to squamous cell carcinoma over time, and they can metastasize. I think it's good to love the warmth of the sun, but you should be protecting yourself when you're out there. And that's from Eve. Yes, protect yourself. Okay, malignant melanoma. Guys, important. Look at this graph here. So, asymmetry. If one part of a mole is not like the other, that's something you should see someone about, okay, a dermatologist about. If it's an irregular border, okay, scalloped border, that's something to see a specialist about. If the color is different, red and black here, that's an issue. If it's a diameter larger than the diameter of a pencil eraser, that's when you see someone. And if a mole changes, those are all signs about malignant melanoma. They're talking about chemicals in sunscreen. Well, I tell you what, that's why I like mechanical blocks. They sit on the skin, they block skin immediately. Someone asked about chemicals in them. Melanoma, guys, lethal. Okay, it kills us. But if you find it early, there's a 99% survival. So if you have any of those signs, if your family does, if your kids do, let them see someone. Okay. Risk factors are moles, fair skin, light hair, previous skin cancers. Melanomas don't really form directly on areas of the sun. This could be on the back. It could be, under the toenails, right? Under the toenails and under nails. It's thought that the sun exposure we get over a lifetime creates free radicals, and those free radicals damage these cells, and that's why we get melanomas in the strangest areas, okay? This is a picture, actually. This was a woman. I'm sorry if this is a little too graphic for you. This is a woman who was in her mid-20s. She had a little mole here. I took it off. It turned out to be cancer, and I had to reconstruct her. I'm telling you, skin cancer can happen even in your 20s. Okay, we're going to switch topics now. I'm sorry. So how many people like that information? Give me some hearts if you liked all the photos there. with all the, I'm sorry, it's a little graphic, I know, but I wanted to educate you guys. I want you guys to learn something. I'm going to say this again. Please share this. Share this with people. Share this with your loved ones. Share this on your Twitter feed. Share it on your Periscope feed. Share this because this is good knowledge for a lot of people to have. So please, this is really going to help a lot of people if you can share this. Skincare products. Let's talk about this. How many people are interested in skincare products and what it does for us? Give me some hearts if you're interested in skincare products. You want to know about it? Should I teach you? Let me get some hearts. There we go. Okay, very good. Okay, let's talk about it. Okay, so the skincare products was actually, the FDA was established in 1936 by the Food, Drug, and Cosmetic Act. They said that cosmetics are substances that are applied to the skin for cleansing or promoting attractiveness. But medicines or drugs have a different purpose. They affect the structure and function of the skin. Okay, there's a difference here. One is for cleansing and one is for really changing the function of skin. We'll talk about that. Medications have to go through years of testing to prove, one, that it's safe, and two, to prove that it does what it claims to do. Cosmetics do not. Okay, they don't have to go through any testing. Cosmetic marketers capitalize on this confusion. They add medical sounding components to their products and claim that they rejuvenate the skin. They do not. This is a multi-billion-dollar fraud perpetrated by the cosmetic industry on the consumer. Because their products do not cause anything but a short-term change in the dead layers of the skin, which gets sloughed all the time, they don't have to go through rigorous testing to prove their claims. The only products that cause true and permanent changes and make the skin better are medical drugs prescribed by a physician. We'll talk about this. So this is a slide again. You remember that slide of the skin? This was the basal cell layer I was talking about before. This creates all the copies above it. So if this copy is healthy, all the cells above it are healthy. Okay? So here we have basal cell layers. Now, alpha hydroxy acids and beta hydroxy acids, they have them in products. You'll see them out there. They will break the bonds of some of these good skin cells. They'll slough off and you'll have smoother skin. Now, I'm going to show you this one. You see these little dots inside the cell? Okay? This we're going to talk about this. Let's say what that is. What's going inside the cell? Because these beta hydroxy acids work outside the skin, but what's going inside the skin? Let's talk about this. Okay, so to prevent sun damage, broad spectrum sunblock every day on your face, your hands, your ears, anything that's exposed. You got that? I think you'll get that lesson today, right? That's the important thing every day, even on a cloudy day, even when you go to the mailbox, okay? I want you to protect yourself. I don't want you to be one of these people who has problems with cancers at an early age, okay? Vitamin C works, idabendone. These are all things that are free radical scavengers. Okay, so how do you repair skin? Okay, I'm going to start. So now you're interested, right? Okay, we know how sun damage occurs. How many people are interested to learn how you repair the skin? You want to know about it? Give me some comments, some hearts. And share this, guys. Share this if you find this interesting. I think this will help a lot of people. Okay, let's go on. How do you repair your skin? Let's talk about it. First one is something called tretinoin. Now, remember this slide I showed you and I showed these little dots inside the cell? Can you see my laser pointer here? Yeah, you put sunblock on in the morning. Yes, classic legacy. This is retin A. Retin A goes inside the cells and actually fixes some of those thiamine dimers I talked about. It repairs the cell and can actually make the skin better. Okay. It also goes down to the fibroblasts and energizes them so you can get new collagen forming. Hydroquinones can actually help with pigmentation. And then medical procedures, chemical peels, laser skin care, and laser skin resurfacing. We're going to talk about this here in a moment. Okay, you guys ready? Okay. Medical skin care. This is using hydroquinones and retin A. Can you see the pigment spots on her forehead? And she had lines around her eyes. You see how it's smoother there? Is that coming across to you guys? Can you see it on your screens? Give me some hearts or some comments if you can see that. This one's a little more subtle. Let's go on. Okay, this is is Hispanic, and she actually, can you see the difference here? The pigmentation is better. This is medical skincare using hydroquinones and retin A. These are great, great products, and they're available mainly through doctor's offices. This woman, can you see her jawline? Do you see this pigmentation? She actually was a tennis player, and you see how it's cleaner here? This is hard to treat, but this is the same thing. They're using medical products, not the stuff you get over the counter at Dillard's, no, okay? Or Macy's, no. Medical products really do the job. This is the difference. That is a waste, okay? Medical products really do a good job. So you can see the difference here in the pigmentation. She was a tennis player, that dark pigment there. Can you guys see the difference there? Give me some comments if you can see that. Give me some hearts maybe if you can see it. You guys see the difference there? Okay, great, great, great. Let's go on. This one's a little more subtle. Fine spots on the face. This is all medical skincare. Now people say, look, I'm dark. Can I do this too? Yes, this woman had darkness on her upper lip and on her chin. Can you see the darkness on the upper lip there and see how it's cleaner here? This is all with medical products. Regardless if you have dark skin, medium dark skin, light skin, medical products can help with all these things. And here are these sun-kissed cheeks. This is a young person with some lines, and look how much cleaner her skin is with medical skincare. Okay, great. Let's go on. The next thing I like to do is I do a lot of stuff with lasers. I call it laser skin resurfacing, and I'm really an expert in this. This is why I have an international practice. I've been featured on Dr. Oz, The Doctors, Howard Stern, the New York Post, the Boston Herald, because I'm really good at this, okay, and these techniques, and we'll talk about this. So I use lasers, and I'll actually go underneath the skin and take off all the damage here, and then the skin grows back normally. This woman actually had lower eyelid surgery and then laser skin resurfacing. And do you guys see an improvement here? Give me some hearts or some comments if you can see the improvement there. Couple hearts? Couple comments. Okay, good, good. Right, this is big deal, right? It looks like her younger sister. Okay, let's keep going. This woman had lines around the lips. How many people are bothered by lines around the lips? How many people are bothered by those? Yeah, do you have lines around your lips? A lot of this people say, oh, this comes from smoking. No, not necessarily. This can come from sun exposure. Sun exposure can etch this in here. Can you see the lines here and how they're smoother here? Right, this is done with this laser technique. This is how I can get the skin better, is I can get underneath the lines and get the skin to come back better. Here's another example of tightening the skin with laser and getting rid of skin spots. So there's someone saying it's from excessive sauce sipping too. Not exactly. The sipping and then going out in the sun, that's what etches it in the sun into the skin. So if you're outside in the sun and sipping that straw, yeah, it's likely you're going to have that. Okay, so I want to show you something. This was, I will tell you that I get educated by my patients sometimes, or my patients can be my teachers, right? If you're my patients, you can teach me sometimes by learning things, right? We're always students learning. So this patient of mine, she had surgery on her upper and lower lids, and I used the laser on her lower lids before. Do you see the difference here? The skin's a little smoother. So she came back to me 2 years later. 2 years later, so the skin's smoother here, right? I feathered it out here with the laser. And she was erupting in skin lesions. Can you see the skin lesions here, all these spots? And how it's cleaner right underneath the eye? Let me show you here. Do you see the difference here? So spots everywhere except, can you see it here underneath the eye? So this taught me something. Guys, what this taught me was that this laser procedure I did 2 years before actually made the skin healthier. I fundamentally made the skin healthier. I think, let's look at the slide here. I'm using my laser pointer. I think she had lesions here. But when I did the laser, I got rid of all those lesions and it grew back. So this was the healthiest skin on her body. I did the procedure on the rest of her face to clean up her face afterwards. This taught me something. So I said, okay, if I do this now on the whole face, I can really get rid of a lot of sun damage. Right? This is before and this is a month later with those skin lesions. And I showed this last time. I know this is a shocking photo, guys. Okay, you say this can't be real. This is real. Okay? She had surgery on her lower eyelids, and she had laser on her skin. But you can see how smooth the skin is afterwards. Give me some hearts if you can see the difference here, guys. Very good. You see it, right? And I know it looks crazy, right? I know. Oh, I like the chocolate hearts. Someone give me chocolate hearts. I love it. That's great. Thanks, guys. So what she had done, you're wondering, so well, how, Dr. Scheiner, did you get rid of all those lines? How did you get rid of that? How did you get rid of that area here? Well, what I did is I used a laser and I went underneath the skin and I removed, she actually was sent to me, guys, by her dermatologist because she had lots of skin cancers that they were constantly freezing off. She was tired of this. So she came to me and I said, you know what, I think I can help you. And yes, it is permanent, guys. I was able to use my laser. I got rid of all this sun damage and I worked on her lower lids also, and her skin looks dramatically better, right? Hey, Olivia Bellsell, thanks for sharing, guys. Once again, I'm hoping you guys share this because it's a lot of good information here about protecting yourself and how to treat yourself. So, okay, now here's another one. And I know, guys, you're going to say, once again, this looks crazy. This woman came from Miami. I'm up in Tampa. I told you, guys, I have an international practice. People come from all over the world to see me because of these techniques. And honestly, I feel very fortunate. I really love helping people. I love being a resource for people all over the world to help them with this sort of thing. So I got rid of these sun lesions, right? And I will say it looks like her granddaughter. How many people think it looks like her granddaughter? Give me some hearts if you think it looks like her granddaughter. Right? It looks like her and her granddaughter. Right, exactly. So in reality, it's her. It's absolutely her. What I did, though, this is the power of what I can do, though, is if I can get rid of some of the damage here, right? And I did do lower eyelid surgery on her too. Her skin can look better. I mean, she relates to the world so much better now than she used to. Do you guys agree? Okay, let me keep going here. And this is a picture of her straight on. Right? It looks like her granddaughter, but it's her. And I'm just so happy I'm able to help people this way, guys. Okay, here's another thing. Now that has recovery, guys. That one has recovery. The laser skin resurfacing has downtime and has recovery. I'm going to show you other things that don't have recovery. You ready? Who wants to see things that don't have a lot of recovery? Give me some hearts if you want to see the things that don't have a lot of recovery. Thanks, guys. Thanks for all the comments. Give me some hearts if you want to see the next level. These are things. There we go. Okay, things that don't require a lot of recovery. Okay, broad-based light. Let's talk about this. We have different things called chromophores or targets for the lasers and the light inside our skin. We have white light that has all these different colors, and we can select out different filters. And these filters can target something in the skin, like red spots or brown spots in the skin. So for instance, you see the spots on her décolletage. Like a lot of women want to wear V-necks, right? And it doesn't help if you have all these spots on your chest. Well, this was done without a lot of downtime. This was done with something called broad-based light. This is actually done in the office. Now, here's the thing. We used to look at this and say, okay, that's better. We're helping them make their skin look better. But are we doing anything else? We're wondering, are we helping them any other way? Well, let me show you something. There's actually research that came out of Stanford, and they did research looking at the deep parts of our cells, something called the messenger RNA in the cell. And they looked at it, and they looked at people who never had this treatment, older people who had the treatment, and older people that didn't have the treatment, and they found that people who were young and people who were older but had treatment started to look more like the people who had younger untreated skin. Meaning, these treatments were not only about improving the appearance of skin. It's nice not to have spots, right? But also, it actually turned the genetic state of the cell back to a younger state. So guys, just like you get your teeth cleaned twice a year, right? You get your teeth cleaned? This sort of broad-based light, if you do this twice a year, your skin will be healthy for a longer time. And this is something I recommend for people. Guys, I do it myself. I get my own face treated because I follow my own research. So here's broad-based light. You can see the difference. This does not have a lot of downtime. These spots get darker and then they fall off. This is it on the hands. Go back here. You see the difference on the cheeks, right? This is on the hands. This is not a lot of downtime, guys. This is interesting. This is a colleague of mine at age 43. He started doing these broad-based lights. And at 55, his skin looks younger because he's been doing this broad-based light for all these years. It's a big difference, right? So these light treatments, that's why I'm getting it done myself. I want to keep myself looking young. So right now, actually, he looks younger at 55 than he did at 43. Okay? So this is something, guys, if you want long-term healthier skin, number one, keep yourself protected from the sun. If you already have damage, if you don't have a lot of downtime, broad-based light. This is something that can help you. This is broad-based light on the face. On the cheeks, we can treat red spots on the cheeks. This doesn't have a lot of side effects. This is something known as poikiloderma observata. I know it's a mouthful, right? Poikiloderma observata. It's a vascular condition of dilated vessels on the neck. Happen to a lot of people who are Caucasian. This is treatable, guys, with this light treatment. We can do hair removal with these light treatments, even on people with dark pigment without hurting their pigment, and that's rare. I've actually had women who had beards that with these light treatments I'm able to treat them and keep their own pigmentation intact, which is good. Vascular treatments, we can treat rosacea. Now, let me talk about this. Red spots and rosacea, there's no cure for it, guys. We can treat it, and we can manage it, but we can't cure it. So it usually takes about 3 treatments to get it calmed down, and then like 2 or 3 times a year thereafter. So that's something that can be managed. This is skin tightening with something called Skin Tight. This is also something that can be done. We can do it on the neck, we can do it on the abdomen, we do it on the hands. So we're almost done, guys, and I'll get questions here in a moment. So the 3 ways, okay, first of all, to prevent sun damage, right? And guys, I'll go through the questions just a little bit here. Number 1, sunblock where? Well, you guys tell me, when should you wear sunblock? Give me comments. When should you wear your sunblock? Just on the weekends? Let me know. If you heard my talk, tell me when you're supposed to wear sunblock. Put in the comments, guys. Let me see what you learned. Come on, guys. When should you wear your sunblock? Exactly. Look at that. Wonderful. Wonderful, guys. Great. Always, all the time. Social science, yes. Love 008. Sticky bee ideas, always. Guys, that's it. Okay? Protect yourself and your family, your kids. Mechanical blocks using titanium oxide or zinc oxide, I like the best. Now, what if you have damage? What can you do? We got 3 options. Number 1, medical skincare, right? Medical skincare that you get at a doctor's office. I have it in my office, and other doctors in your areas probably have this too. Medical skincare is number 1. Using hydroquinones. Yes, cover up your skin too. Hydroquinones and retin-A. Broad-based light, right? This doesn't have a lot of downtime. And then the last thing that I talked, this has downtime, guys. Okay, this has about 2 weeks downtime, but it does give amazing results. And my reset skin resurfacing. These sort of results are why people come to see me. Actually, they found me, on the internet for different things, and I'm just I'm so thankful that I can be a resource to help people with sun damage, and I love helping people. And really, guys, it's more about that. In my last talk, if you go back maybe to catch me, you can see some other lectures. I gave one before on the true definition of beauty. And I want to give you something, because for me, it's not about vanity, guys. It's about communication. I want you guys to be able to communicate the best with the outside world. Our faces really exist for that reason. And that's what this is about. It's not people staring in the mirror at how great they look. No, it's not that. It's about communication and how do we communicate best with the outside world. If we're looking tired or old and we don't feel that way inside, that's not fair. And that's what I love helping people with. I like help people change their facial appearance so that they communicate better with the outside world. Okay, guys. Well, thank you. Thank you so much. Okay, so, guys, here it is. Here's my free book chapter. You go to my Adam Scheiner MD website, www.adamscheinermd.com. And then you see this thing, you type your information right here, type info. You see the red arrow there? I'm doing my green on there, but you want to type in there your info, and you get a free copy of part of my book called The True Definition of Beauty. I think you'll have a real interesting time watching that, and reading about it. So guys, right here, free book chapter, if you found this interesting. And I want to say again, first of all, to our replay viewers, thanks for coming. For our live viewers, you guys were awesome for tuning in. Please, guys, there's a lot of good information. Share this. Share this with your friends on Periscope, on Twitter, on Facebook, wherever you can. Share this information. I want people to know how to protect themselves. It's so important. And unfortunately, if you have been damaged, go back to those 3 things I talked about. The 3 ways to improve sun damage. And number 1, wear your sunblock, right? Okay, so let's see if I go down one more. Okay, and that's my book, The True Definition of Beauty, that you can see. Okay, guys, I will take questions. So go ahead, fire the questions. Thanks, Love008. Yes, I can remove moles and skin tags. Actually, using my lasers, if you go to my Catch Me, you can see a way I use lasers to remove moles. It's a pretty cool thing. And it might be on my YouTube page also. You might be able to find it there. Other questions? So let me show you some sunblock. I'm going to step away for a second here. Hold on. Okay. Can you guys see this? The Catch Me, I think, is Adam Scheiner, MD. This is one, Copper Tone Babies. This has the titanium and zinc oxide. This is another one, Neutrogena, Pure and Free Baby. These are good. Can you see it? Those are good over-the-counter ones, right? And then this is one that I like. There we go. Called Elta MD. It's actually a spray form of those mechanical blocks. If you contact me, we can ship these around the country. We can ship these to you. So if you contact me in my office, we can ship these. I like this. I use this myself. It's a spray, but it's the mechanical sunblock, so it works immediately. I like this a lot. So once again, over the counter. There we go. Copper water babies. It's good. At a doctor's office, this Elta MD works really well. Okay, other questions from people? Other questions? Let me okay, there I am. Questions? Oh, I love all the love. Thank you, guys. You guys are awesome. And once again, please share this because I want people to learn about this topic. I want them to protect themselves. So if you can share this, I'd really appreciate that. And I'm going to have other Periscopes in the future. Follow me, and you'll get an idea for the things that I'm doing, right? And when I have new scopes coming up. My age, I'm actually in my 40s. Thanks. Oh, the split screen. Let me show you. Okay, the split screen. I'm a technical kind of guy, okay? So what I did, let me flip this. There's a way if you have okay, hold on. Let me get to this question first. Is hydroquinone bad for your skin, carcinogenic? No. It's funny, there's a lot of misinformation about this out there. It's been used for a long time. We've used hydroquinones for like 20, 30 years. If you use too much of it, that can be an issue. But that's why you should do it under the care of a doctor. If you do, it'll be safe. Okay, split screen. What I did is I wired in I used the camera on my computer, and I opened something called QuickTime, and there was a way to use it where I actually chose. Let me show you here. Let me see. So here I chose it as I'm using my daughter's iPhone actually to broadcast this, but you can pick the camera here. And then what I did is I put my presentation on one side, and I put this on the other side. So I hope that was helpful. Okay, I'm sorry, other questions? I had to look away there. Go ahead, other questions. The sunscreens, guys, was titanium and zinc oxide. Titanium, well. Sorry, it's hard to do this. Zinc oxide. And that's what you're looking for. You're looking for those things. And I want to thank, once again, my viewers, the live viewers, our replay viewers who are coming out to watch us. Thank you guys for tuning in. Share this so that other people know. Oh, they couldn't see? Okay, hold on. See, it's transparent zinc oxide. Okay. So they want to slope. Okay, actually, you guys want to scope on sunscreen? I can do that. I can do that. You want me to do a scope on how to do a split screen? Okay. Well, I do a lot of TV stuff, so I'm very technically worked on. So yeah, QuickTime is how I chose the camera, and that's what's broadcasting me, and then my phone is facing the screen looking at both me and the slide at the same time. Guys, you were wonderful, and all the comments, I'm really appreciative for you guys tuning in. Please share this. The hearts, you guys are, thank you so much. I want to share this because I want people to know about ways to protect themselves. Please go on my site, get the free chapter. Let me go back here. I gotta click this, hold on. Go to my site, get the free book chapter. Get the free book chapter, you're gonna find it interesting. And then you can learn more about me that way. And guys, yes, please, Karen Jefford invited followers. Thank you so much. Thank you so much, Karen Jefford. That's why I want people to know about these topics. We want to save each other, right? We want to save our skin. We want to protect ourselves. For us, for our children, for our parents, our friends, we want to protect ourselves. And then know that there are ways to reverse sun damage if it's occurred. I have ways to help reverse sun damage. So I'll take one or two more questions, guys, if you want. Oh, Kimberly Pitzenball for us. Thank you, Kimberly. Thank you so much. Oh, and Nails by Katina, you're welcome for the information. Yeah, get the free book, Classic Legacy. Thank you so great. Thanks for giving me the thumbs up there. You guys have been great. I'll take one or two more questions if you want, and then I just want to say thank you so much for watching. Any other questions, guys? You can write to me about if you can tell me what area that you're in, and I can give you advice on doctors in your area. Absolutely. Okay, guys. Well, I'm going to say it's. Oh, Chanel Street, how are you? I think you're from our group. I think you had a scope recently. You guys are awesome. And thank Kim Gars for tuning in. And yes, if you have skin cancer, you need certain ways to reverse it, but there are these things called actinic keratoses that develop into skin cancer. That's where my reset procedure works out so well, because I can actually wipe all that away from the face and the skin can start over again, and then the skin is fundamentally healthier. So we have different lasers to take off skin lesions. Freezing can take them off. I use something called an erbium laser, and I like that a lot for taking off skin lesions. Guys, I want to say thank you. It's lunchtime. I think you guys, well, I don't know where you are in the world. It might be dinner time where you are. But guys, thank you so much for tuning in. Once again, please share this. Replay viewers, thanks for watching. Get the free book chapter. I'll give you more information. You'll really find the book chapter interesting. And guys, thank you so much. I'll flip this. Thanks, guys.